Bismillahirrahmanirrahim. The topic of today's discussion is dengue virus. Dengue virus is a flavivirus transmitted by Aedes mosquito, most common mosquito-borne viral disease in the world. Can present as dengue virus, fever, rash, headache, myalgias, arthralgias, neutropenia. Dengue hemorrhagic fever, which include dengue fever along with the bleeding and the plasma leakage due to thrombocytopenia and extremely high or low hematocrit. Shock syndrome, which include the plasma leakage leading to the circulatory collapse. It is diagnosed by PCR and serology. Dengue hemorrhagic fever is the most common in patients infected with a different serotype after their initial infection due to antibody-dependent enhancement of the disease. Presents similarly to chikungunya virus and is transmitted by the mosquito vector, same mosquito vector, which is Aedes mosquito. Co-infections can occur. Dengue virus is more likely to cause neutropenia, thrombocytopenia, hemorrhage, shock, and death. Live recombinant vaccine uses yellow fever virus as backbone into which the genes for the envelope and pre-membrane proteins of dengue virus have been inserted. Now we will revise. Dengue virus is a flavivirus. It is transmitted by Aedes mosquito. It is a mosquito-borne viral disease. It presents as dengue fever, dengue hemorrhagic fever, or dengue shock syndrome. Dengue fever includes fever, neutropenia, arthralgias, myalgias, headache, rash. Dengue hemorrhagic fever include dengue fever along with bleeding and the plasma leakage due to thrombocytopenia and extremely high or low hematocrit. There is thrombocytopenia, patients start bleeding. In hemorrhagic fever, hemorrhage, so there is bleeding, fever, dengue fever, and there is extremely high or low hematocrit. Dengue shock syndrome, in which plasma leakage leading to the circulatory collapse. It is diagnosed by PCR and serology. Dengue hemorrhagic fever is the most common in patients infected with different serotype after their initial infection due to the antibody-dependent enhancement of the disease. Dengue hemorrhagic fever usually occurs as a secondary infection with different serotype. It presents similarly to chikungunya virus and is transmitted by the same mosquito vector, which is Aedes mosquito. Co-infections can occur between chikungunya virus and dengue virus. Dengue virus is more likely to cause neutropenia, thrombocytopenia, hemorrhage, and shock, and ultimately death. Live recombinant vaccine uses yellow fever virus as a backbone into which genes for the envelope and pre-membrane proteins of the dengue virus have been inserted. Basically, we are using the yellow fever virus vaccine as a backbone and we insert envelope and pre-membrane proteins of the dengue virus to protect the patients from dengue, which is live attenuated or live recombinant vaccine.